according to and the habit of all the global cities in the world. Most of the population, just like Nairobi, which the population is around 3.1 million, over 50% cannot afford the accessibility using vehicles. So most of them walk or cycle to access essential services.
I cycle to work and back home every day. Now kuja kwa CBD bila cycling lane inamaanisha unabishana na magari every now and then. It gets more dangerous sababu una pathway unaweza enda.
Since independence, our infrastructure system has mostly favored vehicle movement. So most of our roads are built mainly for vehicles, not taking interest of non-motorized. As a study has shown, it is much healthier to walk or cycle.
We have already started implementing the Nairobi Master Plan. And within Nairobi Master Plan, we also have NMT Master Plan. With the help of a UN body, Nairobi County was able to develop NMT policy. That NMT policy was eventually approved by the County Assembly, which requires that the Nairobi County utilize at least 20% of its infrastructure development budget on development of NMT infrastructure. So what we want to do now is to implement the master plan, which means that we have NMTs that are well connected to major public transport facilities such as railway stations, bus places, and then connect to residential places.
We took it upon us now to make sure that the most low-income earners who are from informal settlements and disadvantaged areas have access through either walking tracks or cycling tracks to CBD or wherever they would like to access, like hospitals or their workplaces. We have clearly marked it between grey and red, red for cyclists, grey for walking personnel from the informal sectors up to CBD.
We are even using the urban street design, where we are now adapting the 3 meter and above, despite the challenges of limited road reserve. We are having even standalone contracts for non-motorized transport currently, which we have done 2 meter cycle track and 3 meter walkway. Like in, for example, Dunga Road, where someone can walk from, industrial area is a employment zone. So someone can walk all the way from South B area and then follow Dunga Road and join Workshop Road and then cross over to railway station.
There's a conflict between the different traffic mix, and that's why pedestrians are usually the ones who get at. And the number of crashes of people fatally injured or even seriously injured because of road traffic crashes in Nairobi is quite high. Actually, Nairobi is the county with the highest number of fatalities in the country. And for Nairobi, majority of the people who get killed are pedestrians, talking about 65% plus.
Motorists don't much respect cyclists. And the conflicts kwa barabara ama on the roads make the accidents happen more frequent.
Speeds in Nairobi are averagely higher. High speeds increases the chances of a crash. And as I've said before, 30 kilometers per hour as a maximum should be instituted on such roads. And here you're talking about some of the virtual majority of high-risk roads in Nairobi. The second part of it is that we do not have enough facilities, what we call NMT facilities in Nairobi. Those includes those ones, the walking paths, the crossing paths, designated crossing areas, among so many others. Then 3 is that there's also that threat of whereby different users increase what you call the behavioural aspect. Here you're talking about people driving while drunk, for example, so that's a behavioural aspect. And in that case, it exposes the pedestrians who are the vulnerable road users to road traffic crash. And in that case, that's why the numbers are high. Also, pedestrians at times have a behavioral aspect which also increases the chances of a crash. Here we are talking about what we call distracted walking. In this case, we mean that someone walking around with phone, for example, what are these actions which we're going to put forth? It touches a number of areas. We need to have a proper infrastructure or improved infrastructure touching on pedestrians, because without the infrastructure, then it's going to affect the way the road users, especially in this case pedestrians, are going to be affected by this problem. One is having the right footpaths for these particular road users so that they can walk and quite separated from motorized traffic.
Ilikuwa ngumu kwa sababu kama sasa hivi unaona magari ni mengi, pikipiki ni nyingi, baskeli ni nyingi. Alafu pia na sisi wenyewe wa miguu tena. Ikawa ni shida sana. Unangoja kaza gari zipite na una take time kungojea so that gari zipite. Kitambo unataka kupita, baskeli imepita, pikipiki imepita.
But now we are trying our best to share that road.
Two is designated crossing points. If a number of them have been done, like in Thika Road, amongst other roads, but that is not enough. We always say that we need to have as many NMT facilities and crossing points as possible where there is an increased chance of a pedestrian getting injured. And working with the Nairobi Metropolitan Services and the county government, what we need to do is we come up with what we call enforcement operation plan. One is enforcement of use of designated crossing points, so that we don't have what we call jaywalking, people just walking on the road anyhow. But ensure that we funnel these people, or rather we encourage them by use of law and enforcing the use of other designated areas. We also enforce the speed limit so that vehicles don't drive at high speed. Remember, speed is one of the biggest risk factors as it relates to pedestrian fatalities. Enforcement of even this aspect of distracted walking by pedestrians. And enforcement of motorcycle laws so that they ensure that they don't use the roads which are meant for NMT. Here you're talking about even to remove completely encroachment of NMT facilities by either vendors or motorcyclists or even motorized traffic, so that people don't park around some of those motorized, so that the roads become clear.
Inatusaidia sana. Watoto walikuwa wanagongwa ovyo ovyo, walevi, na sasa hii mambo na kuongwa imeisha.
Being able to engage with Nairobi Metropolitan Services to improve NMT facilities has been an incredible experience. We would like to continue partnership towards actionable research on improving NMT in Nairobi. We've been able to also engage with Mombasa City County Government and Kisumu City in order to learn from each other, to practically see how can we be able to improve NMT facilities in Kenya's largest cities.
I think this is a good practice, and I thank them for bringing us together for this peer learning forum, and I encourage them to continue doing so.
The peer learning was amazing. First of all, I enjoyed it a lot. I liked it because of the fact that as much as we are in charge of a county, but at the end of the day, we are all Kenyans, and when Kenya prospers, even the counties prosper. So whatever good ideas that we have in all our counties, is good to share it among each other, because there are success stories in every county.
For Kisumu, one of the things that we saw and thought that it's a high time we implemented that in Nairobi was the common surface duct, which has been thorn in the flesh in our works.
Ours is to make sure that in-house capability is built up to the standard where they don't have to contract to maintain the roads and NMTs. So we are in the process of recruiting, training various road engineers and buying the equipment. These roads and NMTs are sustained post-NMS.
Hii barabara inatusaidia kwa sababu sisi kama wazazi tunapoachilia watoto wakienda shule. Kitambo unajua ulikuwa unajuaga sasa lazima uzindikishe mtoto wako na umuangalie, lakini kwa saa hii tunaridhikaga na hizi path kwa sababu hizi footpath, kwa sababu ziko mbali na barabara na mtoto akienda tunakuaga tumeridhika.
On behalf of the National Transport and Safety Authority, my name is Njao. I'm the Director General of NTSA. I will be supporting all the studies and the 16 recommendations provided in the study here by CDKN to be able to support and improve on the non-motorized transport network within Nairobi and its environs.